How to treat and cure post-traumatic stress disorder. Post-traumatic stress disorder symptoms, causes and effects. Post-traumatic stress disorder, PTSD, is brought on by witnessing a terrifying, usually life-threatening, event. Severe anxiety, flashbacks, uncontrollable thoughts and nightmares are common symptoms of the illness. These symptoms can worsen and last for years, so it is best to seek treatment for PTSD as soon as possible. 3 different types of post-traumatic stress disorder exist. If symptoms last less than 3 months, the condition is considered acute PTSD. If symptoms last at least 3 months, the disorder is referred to as chronic PTSD. If symptoms manifest at least 6 months following a traumatic event, the disorder is classified delayed onset PTSD, according to the National Institute of Health, NIH. Post-traumatic stress disorder is a mental health condition that is triggered when a person witnesses a psychologically traumatic event, such as war, a natural disaster, or any situation that invokes feelings of helplessness or intense fear. While most people eventually adjust to the after effects of such events, some people find their symptoms getting worse with time. These worsening symptoms are the product of PTSD. As is usually the case with mental health issues, doctors cannot pinpoint why some people develop PTSD. According to the Mayo Clinic, probable causes of PTSD include inherited mental and personality traits, a culmination of life experiences, and the way hormones and chemicals are regulated by the brain when responding to stress. The Mayo Clinic mentions several recurring symptoms, including fearful thoughts, flashbacks and bad dreams. These symptoms can become problematic in a person's life. Some of the avoidance symptoms include difficulty remembering the traumatic event and avoiding reminders of the experience, such as places, people and objects. Hyperarousal symptoms may also arise, such as feeling tense, being startled easily and having trouble sleeping. While it is normal to experience some of these symptoms after a terrible event, symptoms lasting more than a few weeks may be signs of PTSD. Emotional symptoms of PTSD. The emotional symptoms of PTSD are depression, worry, intense guilt and feeling emotionally numb. Another symptom is anhedonia, which is characterized by a loss of interest in formerly enjoyable activities. The National Center for Biotechnology Information, NCBI, states that anhedonia plays a part in predicting psychiatric comorbidity, or the presence of more than one psychiatric disorder. Physical symptoms of PTSD. The NCBI has documented many physical complaints among PTSD sufferers. The physical problems reported included higher rates of neurological, respiratory, musculoskeletal and cardiovascular symptoms. Feelings of depression, guilt, tension, worry and difficulty sleeping may contribute to the physical ailments. Short-term and long-term effects of PTSD. Post-traumatic stress disorder causes short-term memory loss and can have long-term chronic psychological repercussions, according to the American Psychological Association, APA, and the NCBI. Fortunately, psychotherapeutic intervention and treatment can alleviate and often eliminate short-term and long-term effects of PTSD. There are free, anonymous self-assessments available online, such as this test offered by the Anxiety and Depression Association of America. Post-traumatic stress disorder medication, PTSD drug options. Per the NIH, the United States Food and Drug Administration has approved sertraline, Zoloft, and paroxetine, Paxil. Both antidepressants, for use as post-traumatic stress disorder medication. The side effects of these drugs include headache, nausea, sleeplessness or drowsiness, agitation or a jittery feeling, problems having or enjoying sex. Most of these symptoms tend to subside after a short period of time. PTSD drugs, possible options. Doctors may prescribe medications other than Zoloft and Paxil, especially if comorbid disorders exist. According to the NIH, Benzodiazepines are used to aid relaxation and sleep. The side effects include problems with memory and the risk of drug dependency. Antipsychotics may be prescribed. They are typically given to patients with coexisting conditions, such as schizophrenia. Some side effects of antipsychotics are weight gain and a higher risk of heart disease and diabetes. Additionally, other antidepressants may be used as PTSD drugs. Possible options are fluoxetine, Prozac, and citalopram, Celexa. Medication side effects. In addition to the side effects already listed, the following side effects may occur: dry mouth, increased appetite, blurred vision, dizziness. Some antidepressants have a higher likelihood of causing weight gain than others. Nausea and headaches usually stop occurring within a few weeks of starting the medications. For dry mouth, chew gum or suck on ice cubes. If you experience drowsiness, take your medication before bedtime. Likewise, for insomnia, take your medication in the morning. Drink a lot of water to avoid constipation, and refrain from use of tobacco, alcohol and caffeine to lessen dizziness. Talk to your doctor about how your medication affects you. There may be options that are more suitable if you find the side effects of a particular medication overwhelming. PTSD, drug addiction, dependence, and withdrawal. The Journal of the American Academy of Family Physicians warns about the abuse risk of benzodiazepines. When taken chronically, they can be addictive, but they are relatively safe when taken in moderation. If you have a history of substance abuse, benzodiazepines should not be used. It is important that you not cease taking your medication, as this can cause withdrawal effects and lead to recurrence of the symptoms of your illness. Instead, ask your doctor about weaning you from the medication. Always consult your doctor about your medication concerns so you can plan an alternative PTSD treatment regimen. Medication overdose. Overdosing should not be a concern if medication is taken only as prescribed. The National Safety Council advises that you never take a higher daily dosage than recommended by your doctor and that you not refill your prescriptions early. Avoid alcohol or sedatives when taking medications, and tell your doctor about any other medications you are taking. Always keep medications in their original container. Read the leaflets that come with your medications to familiarize yourself with side effects, signs of toxicity, what to do if you miss a dose, and what to do in the case of medication overdose. If you have any questions, ask your doctor or pharmacist. If you think you may have overdosed, go to the emergency room immediately. Depression and PTSD. Depression is characterized by feelings of sadness or low mood lasting more than a few days. Depression and PTSD commonly occur together. Almost 1 in 10 American adults suffer from depression in a given year, according to the United States Department of Veterans Affairs. Depression can affect your ability to perform daily functions and can diminish your quality of life. It also has adverse effects on eating and sleeping habits. Depression is 3 to 5 times more likely to be diagnosed in people who are living with PTSD. If you no longer care about activities you once enjoyed or are having thoughts of suicide or hurting yourself, seek help immediately. Dual diagnosis, addiction and PTSD. Studies conducted by the National Center for Posttraumatic Stress Disorder found a high correlation between substance use disorders and PTSD. For patients suffering from these co-occurring disorders, studies suggest keeping detailed journals of your feelings, thoughts and behaviors and then talking to your doctor about them. Be sure to discuss issues you may be having with substance abuse and PTSD, as a big deterrent in the efficacy of treatment is the tendency to focus only on the condition that seems to be bothering the patient most. Communicating with your doctor is of the utmost importance in treating any disorder. Post-traumatic stress disorder treatment program options. Post-traumatic stress disorder is a condition that affects millions of Americans every year. Government statistics indicate that 3.5% of the general population suffers from PTSD. The disorder is strongly associated with soldiers due to the many instances of traumatic events they endure while at war, but the label can be applied to anyone who experiences the effects of a trauma. The individual may have experienced the trauma personally or may have the condition as a result of a traumatic event that happened to a loved one. It is not uncommon for people to develop PTSD after the death of a family member. Post-traumatic stress disorder is caused by significant trauma in a person's life that is left unresolved. While PTSD is commonly associated with members of the military, anyone who has experienced trauma in life can develop PTSD at any age. PTSD is classified as an anxiety disorder in which a person's normal response to danger becomes distorted. After going through a traumatic event, the affected individual may be triggered and have a fight or flight response long after the event has passed. Fight or flight responses are natural, but when they are triggered by daily events, the results can be debilitating and even dangerous. It is crucial to get help for PTSD symptoms that last longer than 6 to 8 weeks. After 8 weeks, the symptoms are likely permanent and will only worsen with time if they are allowed to continue without medical intervention. Like other mental disorders, PTSD responds well to treatment, and affected individuals can look forward to positive results once treatment begins. As with most mental illnesses, no cure exists for PTSD, but the symptoms can be effectively managed to restore the affected individual to normal functioning. The best hope for treating PTSD is a combination of medication and therapy. By working with a healthcare professional, individuals with PTSD can resolve their triggering factors and learn new and effective ways of coping with the stress of the past trauma. Numerous therapies are available for the treatment of post-traumatic stress disorder. Some of the most common therapies used to treat PTSD include group therapy, psychotherapy, cognitive behavioral therapy and hypnotherapy. In some cases, doctors will recommend a combination of one or more therapeutic approaches in order to meet the needs of the individual patient. In general, no right or wrong approach exists when it comes to the treatment of PTSD. Some individuals respond better to a certain treatments than others. The effectiveness of a given treatment depends on numerous factors, including the individual's personality, the nature of the trauma, the severity of the symptoms, and the presence of a support network. While multiple forms of effective treatment exist for PTSD, some treatments have been found to be more effective for the overall population than others. PTSD therapies are aimed at managing the symptoms of the disorder and helping the affected individual to better understand the causes. Some common symptoms that affect the lives of people living with PTSD include night terrors, flashbacks, avoidance, emotional numbness, indifference. These symptoms can cause extreme disruption in an individual's life, yet the government estimates that a massive 50% of those who have PTSD do not seek treatment. Individuals with PTSD do not seek treatment for various reasons, ranging from fear of judgment to an inability to cover the costs. Cognitive behavioral therapy treatments. Cognitive behavioral therapy is an increasingly popular form of therapy that initially became well known in the 1980s. It blends the principles behind cognitive psychology and behavioral therapy to create a comprehensive treatment approach. The cognitive element focuses on the ways the human ability to problem solve and think rationally can aid recovery. The behavioral element focuses on the ways in which the health of the mind manifests through human behavior. Most cognitive behavioral therapists will work on helping the PTSD sufferer come to terms with the traumatic event and then find ways to modify behavior to cope more efficiently. Other therapeutic methods. Group therapy is another major treatment method for patients with PTSD. The major benefit of group therapy is it allows victims of trauma to connect with others who truly understand what they have been through. That understanding is also important for victims of violent crimes who may be alienated from their peers due to the uncommon nature of their experiences. Group therapy offers a safe place to discuss the traumatic events as well as any resulting feelings and behaviors without fear of judgment from others who have not been through a similar experience. Another common therapeutic approach is hypnotherapy, although this form of treatment is typically used in conjunction with traditional therapies. Hypnosis is often used to help the patient deal with the trauma by regressing back to a state before its occurrence and to use the power of the mind to overcome any resulting behavioral issues. Residential inpatient PTSD treatment centers. If your loved one is suffering from post-traumatic stress disorder and wants to seek treatment, residential or inpatient PTSD treatment centers are a solid option. These centers are staffed by trained specialists who can assess your condition and formulate the best treatment plan for you in an atmosphere that is as stress-free as possible. The benefits of residential PTSD treatment. One of the most difficult aspects of living with PTSD is the fact that the individual can easily be triggered by ordinary events. Gunfire, fireworks, bright lights and other common occurrences that are jarring to the senses can transport someone with PTSD back to the state they were in when the trauma occurred. These flashbacks often occur at night while the person is sleeping, but they can occur at any time, severely disrupting the flow of normal life. A residential treatment center gives patients the opportunity to recover in an environment that is free from the stresses of everyday life and surrounded by professionals who understand the nature of what they are going through. How to find the best PTSD treatment facility. When it comes to finding a PTSD treatment facility for yourself or a loved one, you understandably want the best. Many great treatment facilities are filled with knowledgeable mental health professionals who are waiting to help you meet your treatment goals. It is possible to live a normal life with PTSD by managing the symptoms and finding a strong network of support. Some programs are better than others though, and the sheer variety of information on the internet can be overwhelming at times. Post-traumatic stress disorder is a challenging condition, and recovery is a long-term goal rather than something that can be achieved immediately. Fortunately, support is one of the most effective tools available when it comes to treating the causes and symptoms of PTSD. A strong network of family and friends is crucial to the recovery process, but it is also necessary to work closely with a mental health professional who can monitor your progress and well-being. It's important to find help on treating post-traumatic stress disorder for you or your loved one. Estimates suggest that up to 70% of American adults have experienced at least one significant trauma during their lifetimes. Many of those people may subsequently have suffered from an emotional reaction known as post-traumatic stress disorder or PTSD. Further estimates suggest that 5% of the population currently lives with PTSD. Post-traumatic stress disorder occurs in some cases when people are exposed to a very stressful event, which is known as an extreme stress trigger. To be diagnosed with PTSD, they must continue to experience symptoms of PTSD for at least 1 month after exposure to this trigger. Although women are twice as likely as men to develop PTSD, anyone who experiences an extremely traumatic event may develop post-traumatic stress disorder. Examples of extreme stress triggers include criminal assault or rape, natural disasters, serious accidents, combat exposure, child physical or sexual abuse or severe neglect, witnessing traumatic events, imprisonment/hostage/displacement as refugees, torture, the sudden unexpected death of loved ones,